Dr. Rajiv, and thanks for the opportunity to be presenting in this India-Israel conclave. Like Dr. Prem Nair said, I also had an opportunity to visit Israel, and I was invited by the Ministry of Health to be part of a delegation from India. And what really, I think it happened a few years back, and what really impressed me was, the startup ecosystem, the agility, and their ability to think for the future. Anything that, we could see as technology. Where always having the user in mind and having a problem-solving approach, and to make it easy for use. That's to make it simple, and that's when adoption. That's when the adoption increases. And specifically, in what I see in this new normal is all of what we have seen as technology, where we have partnered with a few companies. Of course, MOBILEODT is one, and Mennen Medical is one, and a few others like Noga and Genesis, which we have just signed up. We clearly see them as to be a huge opportunity for early health, prevention, and of course, safe care, safe access. All of that is very important in the new normal. Is possible with such technology, and I really hope to add much more to our portfolio. And so we'll start. Hari Krishnan, I request you to share my slides, please. So as we are discussing, screening solutions truly, is going to be an essential for the new normal. And because of the fact that, prevention and early health. Prevention and early health is, going to be the standard of care. So can you please go to the next slide, please?
Yeah, one moment. Just.
So now when we talk about prevention, it's about screening, it's about health monitoring, regular health monitoring, and it's also about lifestyle. And in all of this, it's very important that, as a technology company, we bring in, an ability to be able to, go for mass adoption. And that's where truly all of these technologies that we partner with the companies from Israel, come very handy, because, they have a connected ecosystem, there is tele-enabled, and there's a lot of work on artificial intelligence, which helps to truly make, the diagnosis simple, easy, and early. So I think this truly is a big leverage. Technology is a big leverage when it comes to prevention in healthcare. So can we go to the next slide, please? So now, how we look at this is because that's why I said even earlier, transaction in healthcare can never be the order of the day. We'll have to look at always as to how we can solve for problems, and problems, can be only solved if we look at, with the holistic care cycle approach. And when I say care cycle, it always obviously starts with the patients. How we can, in a country like ours, when affordable care is very important, and also the cost of care being the lowest across anywhere in the world, we can't always expect the cost of care to go down. What we have to be responsible about is about how we can treat early and thereby reduce costs. And also a typical thinking in our population is that we have a treatment mindset. So we typically go to a doctor, in the last stage. And at that stage, it's very, very difficult for anyone to reduce cost of care. And more importantly, to be able to save lives. So this is what is changing. And thankfully, if one thing which has happened over the last 5-6 months with this pandemic is that awareness, and of course the want, the need, and also the desire to be able to want to take good care of health, and where screening is going to be important, and early monitoring is going to be important, is a welcome change that's happening thanks to the pandemic. And thankfully, the technologies that we bring in, with this partnership with our companies in Israel and any part of the world, are going to play a very, very major role. And why I'm saying this is because typically in a treatment mindset, the ecosystem is geared to look at, diagnostics for treatment. Whereas in the new normal, the scenario is going to be very different, where we are going to be very, very cautious about use of technology very early and at point of care, at a position, and with the physicians to be able to, provide early care. Let's go to the next slide, please. So now, what are the solutions that, while we always talk about the new normal as COVID care, there is also non-COVID care. There is a lot of care healthcare that we need to do even beyond COVID. While screening, early screening, prevention, awareness, and all of this is gaining a lot of ground, at this time. But we need to be very careful, and we need to be very cognizant of the fact that we cannot afford to ignore any of the other health conditions, and cannot defer anything, and because most of these also become comorbidities, and especially in area of mother and child and newborn, and in those in cardiac care, and in any of the chronic care that we have to deal with. And it's very important that there is always a constant and continuous care that is provided, that is not ignored at this point of time. So now, what is GenWorks? GenWorks, is a pan-India distribution platform. We bring in the best of the technologies, and a few companies that we are going to talk about now on the products and solutions are from Israel. And we have a lot of tenure in this industry. The leadership team has 200 plus years of experience in healthcare. We have got a lot of connect with customers, and we have covering 500 plus districts of the country. And our significant difference that we want to bring in the industry, in the healthcare industry, is early health, and we believe that digital is the way forward. Digital and connected ecosystem is the way forward. And talking about the products that we are exclusive partners for from the companies from Israel, MOBILEODT is one. And I'm sure most of us know that cervical cancer, or cervical health itself, not even cervical cancer, cervical health is a very, very important aspect, and one of those which is ignored. And the reason it's being ignored is because of two reasons. One is women don't complain till it's very acute, and even if they complain, they don't really follow up and take good care. So now there is no way, if you can not provide technology at the point of care of the gynecologist, the technology that the gynecologist can use and determine the treatment, and determine the treatment at that point, we will end up missing out, or missing out on care. And when care is not provided in time, unfortunately, these become potential people who go into a cervical cancer, and then at a late stage, they end up spending a lot of money, and of course also we lose lives. So I think MOBILEODT caused a significant disruption in this the way cervical health and cervical cancer screening is done. They came out with a wonderful device which can be used at point of care, which is on par with any of those traditional products which are bulkier and expensive, to be able to bring in a point of care cervical screening device which can be used even by paramedics, and which can remotely be connected to specialists. And in a country like ours, where specialists are scarce, and a time like this, when safe access is very important, this product just fits the bill. And it, I could even say that it's an extension of a gynecologist stethoscope. We can even call this a gynec stethoscope because today it's a device that is needed, and cervical health and wellness cannot wait. And it's very important that we see early, and when we see early and we are able to identify the problems, we are able to treat early, And when we treat early, the cost of healthcare comes down, and the mortality also comes down. So this is one big partner that we have, and very soon they are launching AI. And when they launch AI, it's going to make it even more easier, because to have a diagnosis, at the point of care, that a specialist can look at and also add their views into it, and to be able to start the treatment early. This is a significant success story of GenWorks as a partnership with MOBILEODT. We already have several hundreds of this equipment, that is across the country, not just in a few pockets or in the metro or tier 1, where typically the new technology gets in. This is spread across the country, and our partnership is growing in strength. Similarly, Mennen Medical, one of the first companies that we tied up, with Israel, the Israel companies that we tied up, a very good partner. And, we used to have a cooling system also, which they used to have in the past for hypothermia for babies. But right now, they have a non-invasive bilirubin solution. What the interesting part about all these products is these are futuristic. These were technologies which were built so beautifully that, it could actually fit in seamlessly, even normal times and even in the new normal. Why I'm saying this is because, this is a very, very intelligently crafted, bilirubin meter, which is not the conventional bilirubin meter, which used to disturb the baby and, had a lot of limitations, and was more created, to reduce the number of, blood samples being taken or the pricks on the baby. But this is one intelligent device which can be used by a paramedic, and it's since the area which is where it's going to look at is the baby's ear, and baby is sleeping, you don't have to undress the baby, and you can take the bilirubin measurements, and you can kind of use it as a regular screening while the baby is in the nursing home, or before the baby is discharged. And in times like this, when hospital admission and people are not wanting a lot of the pregnant ladies to be in the hospital for a longer time, it comes in very handy, because you can screen whenever you want, as many times as you want, and certainly before the discharge, you can use this device. Another very intelligent thing that this intelligent feature of this product is that it's also available for an outpatient care. The same device can be used in the hospital, and the same device can be used efficiently when the baby comes back for outpatient consult, because it adjusts for the sunlight or the light that the baby which typically changes the readings in any other system. Here you are able to clearly and accurately in all settings, both within hospital and in OPD settings, whenever there's a need, you'll be able to look at the jaundice levels and the bilirubin levels and determine what kind of a care has to be given. So fundamentally, these devices, the agility of these devices, the way these are designed, and it's very important as technology companies and as distribution platform as ours to be able to take this to the customers, and to be able to take this and make customers understand that this is just an extension of their everyday consult or everyday, it's like a point of care device which is always available in their, codes, and they can just pull it up and use it seamlessly, and which offers an enormous, support for their decision making and early treatment. So can we go to the next slide, please? So we have also added a few more companies. We have been privileged to add, Genesis to our portfolio. We just signed up recently with them for predictive health. This is an amazing, I'm sure you heard the CEO of Genesis earlier in your, in the webinar, in the earlier series that she spoke. This is completely going to transform, the way we are able to going to predict. And when we predict early and we are able to prepare ourselves, the care is going to be treatment and care is going to be totally at a very different level, and it's significantly going to reduce cost burden, and it's significantly going to help, improve our ability to save lives. And another company which we have recently signed up is Sinoga Medicals. Again, one of the best companies when it comes to remote monitoring. It completes, monitoring from every aspect. From every aspect, we just not in just few parameters. It's just not some vital monitoring. It's a holistic, complete solution which gives, which helps us to remotely monitor the condition of the patient, whether in hospital or outside the hospital or in any setting, and to be able to have information which is so crucial and vital to be able to make decisions. So we are very happy to say that this partnership of GenWorks and the companies from Israel, and especially with support from Ministry of Health, Mr. Tejinder and Mr. Shai Moses, and we've all been a great help. In fact, they have worked very closely with us, and they've been able to connect us with all these companies. And let's go to the next slide, please. So typically, as I said, the technologies with the startup mindset, and with Israel being the technology paradise and the startup paradise, and India being where these technologies can really have the use, because it's a vast country, and GenWorks being a partner which is a pan-India distribution partner of scale, we are able to, it's a perfect fit. We are able to, all of us know that as much as we talk about Make in India, we don't have enough of this made in India. But, while we wish that happens sometime, for me, the way I look at it is all of what that, is made in Israel, has potential, for affordable care, and has potential for, expanding access. And, this is something with a company like us, is a true fit. And I'm sure this partnership and many more companies will be, Israel companies will come in to work with us. And we certainly will be able to take healthcare to the last mile.
Thank you very much, sir. Thank you.